Hello, my name is Alex Mejia. I'm a division director at UNITAR, the United Nations Agency for Training and Research, based in Geneva. And I welcome you all to this COVID-19 crisis management webinar focused on practical experiences from Europe and Africa. We have a very ambitious agenda today, and we will dedicate around 1 hour and 45 minutes to this. I wish to welcome and thank all the speakers and at the same time all the participants from very many countries that have decided to join us. We will do two things. One, in general terms, of course, is to try to understand as a whole what has happened with the coronavirus pandemic. It's been a very difficult time for this planet of ours, a very complicated stage in our history as humankind. We cannot recall in history annals of something similar to this thing, not even with the pandemics of the Middle Ages. So in the first presentation that I will have the privilege of delivering and sharing with you, you are going to see that view of the whole and exactly where we are now with COVID, with numbers and data as of yesterday. But the second part is perhaps the most interesting. We will be having speakers, very prestigious speakers from South Africa, Senegal, Turkey, Spain, and also from the United Kingdom and France, because we have a speaker that comes from both. He is a British national and highly regarded in London, but also lives in France, and I will properly introduce him when the moment comes. But with all these speakers, we will aim the second part of this webinar to get more profoundly, more specifically on the cases of these countries that we have invited to participate in this webinar, so we can understand different perspectives and hopefully have at the end some short interaction with some questions from the public that you are invited to post in the Q&A that you see at the bottom of your screens in this Zoom platform, but also to get to hear from people that are really on the ground right there in these countries and in the cities that you will hear about. This is happening because UNITAR is very honored and thankful with the privilege of leading the CIFAL global network of 20 training centers around the world that were created, initiated more than 16 years ago. These training centers are duly represented today by several of their directors, and I will also be very happy to introduce them when the moment comes. With that short introduction, I would like to begin now sharing a presentation that we have prepared and that you have in front of you that will let us know where we are. So, as you can see on the screen, we have 213 countries and territories, 194 countries officially in the world, but there are several territories that we also must observe. In total, that number basically tells us one thing, is basically the whole world. These numbers are as of 22 April. Next, please. By the way, there is a small time lag between one slide and the other, so please bear with us. So, as you can see on the screen, between 15 March and 22 April, so this is literally 5 weeks and a little more, you will see that we have a very aggressive increase. We went from 169,000, so this is less than 200,000, to more than 2.5 million. So exponential growth, tenfold. And you can see there also the number of deaths, very sad. We are all suffering this, some people very closely, but there is no one in this planet, I dare to say, that have not been touched by the size of this negative outcome of the pandemic. 178,000 deaths as of last night at midnight is simply a number that cannot be ignored. And we began with 6,000 in the number that you see to the left on 15 March, when the pandemic had only 5 weeks also. So the first five weeks saw those numbers to the left, and the next 5 weeks see the numbers to the right, which is what we have as of now. Next, please. Here, you can see the exponential growth that I just mentioned in March and April, and especially in April, 2.5 million. And then, as you can see in the number of cases by date reported, this pandemic is still growing. If you see at some countries, thank God, the number of infections have plateaued. The curve is now perhaps flat, in some cases even decreasing slowly. But in other countries, that is not the case. And in Africa, is definitely a different scenario from Europe and North America, because in Africa, the numbers are rather low, but we will get into the dialogue of trying to understand what will happen if those numbers start growing aggressively. As of now, as of yesterday, 83,000 people tested positive in the COVID tests that are administered by the governments and hospitals. Next, please. So with those numbers, now we will go to share with you something based on a McKinsey Outlook on the Global Economy report that was shared 3 or 4 weeks ago in a webinar that McKinsey organized with our brothers and sisters of another UN agency called UNDP, the United Nations Program for Development. UNDP and McKinsey put together this webinar, and since the presentation share has been upgraded, but it was an eye-opener to hear the people from McKinsey consultancy, which is highly respected around the world, giving us 2 possible future scenarios, one with a short recovery and another one with a prolonged recovery, which I am going to explain in the next slide, please. We divide each scenario in several components, but before, it will be important to see that COVID-19 is indeed more dangerous than the flu. It has almost double the reproduction rate of the flu. 17% of the cases are severe and require oxygen, and 5% of these cases require intubation, ventilation to the lungs, which is even more critical in an ICU, an intensive care unit. And this is a lot higher than what we normally observe in the flu. There is a mortality of between 4 and 5%, depending on the country that you look at, as estimated currently by WHO. Just so, again, you have a comparison with the flu, with influenza. Influenza kills 0.1% of the people that it infects, less than 1%. COVID, the coronavirus, and the disease it produces, COVID-19, kills 4 or 5 people of every 100 infected. To the right, you see a comparison with other diseases in terms of the case fatality and in case of the reproductive number. And COVID is really not that aggressive as compared with others, but the way the contagion happens is very much different, and easy, to put it in easier words, because I'm not a doctor, of course, it's a lot easier to catch COVID. Next, please. In this slide, you see in these exponential growth lines how the pandemic has evolved in the month of March and April in Spain, in France, in the United Kingdom, in Turkey, in South Africa, in Kenya, and in Senegal, which are the countries represented today by the prestigious speakers that will be taking the floor very soon. Next, please. So we were saying that in the first scenario that McKinsey proposed and UNDP embraces, we would like to hope that indeed there is a short recovery out of this pandemic, but that will assume that the virus continues to spread across the Americas, Europe, and Africa until the mid of the second quarter, which is the mid of May or so, when virus seasonality, the change in weather patterns in the Northern Hemisphere, combined with a stronger public health response, drive caseload reduction. And of course, the pandemic starts decreasing. But the case of Africa is rather particular, because there are less than 30,000 cases in the continent as of now. And several countries have imposed lockdown that you are going to hear about. especially the case of South Africa is very unique because that lockdown is, of course, affecting the livelihood of the population, and that can lead to social unrest. So it's very complicated because even if this happens, and for that the lockdown will be needed, there are very many social outcomes out of that. You see here to the right in the epidemiological scenario, a focus on the tests and on the test availability, because we will never know really how many cases a nation or a city or a neighborhood will have until testing is widely spread. So it has improved, but it's a long way to go to reach the ideal standards of testing that the WHO recommends. And then we assume in this scenario that new case counts peak by the end of April now or early May, and declines by June with a stronger public health response and seasonality of the virus, as I mentioned. Fall 2020 sees a small resurgence of the virus, although more countries have better public health preparedness. And China and East Asian countries continue the current recovery and control the virus by June or late June. Next, please. So you can see that we have also in the economic impacts of this short recovery scenario, some very difficult things to understand, but this is happening. McKinsey did an excellent job in calling our attention to that using the right macroeconomic data. While China and East Asian countries have started recovery, supply chains remain impaired. And in much of the second quarter, consumer spending is subdued. The biggest market for the Chinese exports and South Korean exports and Thailand exports of industrialized goods and so on, are even Vietnam, are of course North America and Europe. And as long as you have that demand reduced, that will be complicated. By the way, I forgot to mention, if I may, you will have several short polls or questions presented on the screen, so the participants can tell us a little how you heard about this webinar, the type of organization you are in, and also some questions on how this has affected you. In the US and Europe, large-scale quarantines, travel restrictions, and social distancing measures drive drop-off in consumer spending and subsequently business investment decreases in the year 2020. Layoff drive unemployment rates higher. That is a problem that we are already observing aggressively, more and more unemployment. Corporate bankruptcies spike, putting pressure on the banking financial system. However, we have heard that the experts do not fear financial contagion if one institution will get in trouble. And perhaps we need to learn some lessons from the global financial crisis of 2008 and 2009. Then monetary easing, which is no more than injecting more money into the economy, has limited impact with already low rates and fiscal responses proving insufficient and poorly timed perhaps. And some self-reinforcing recession dynamics extend GDP declines through the third quarter. Now we are talking about July or September. And the recovery in this short scenario begins only in the fourth quarter or close to the end of the year. 2020 global GDP growth falls sharply, driven by recessions in the US and Europe, and slower growth in China and other Asian countries is observed. Next, please. Here you will see a graph that is really shocking. And if you update this, we will have the update by the end of April, but I have been monitoring as of last Monday what happened with two of these stock markets. And it's really disheartening because, as you know, this is a good thermometer of what happens in the economy. So there you have a chart of the equity markets by country and what happened in the last 5 years or so, 12 years or so. And in 2020, you see the real negative turn of those curves because equity markets plunged in March and have continued down in April as fear of a recession drove investors to safe havens. Most stock exchanges lost around 1/3 of their values. And these are the numbers for India, the US, Brazil, Germany, China, Japan, the UK, France, and Russia. So everyone else that must be accounted in this analysis. Next, please. Now, let me go to the other scenario. What will happen if there is a prolonged recovery, that if it takes longer to recover? And our colleagues at McKinsey at UNDP propose that the virus spreads globally without a seasonal decline, so there is no decrease in the number of people infected when the weather changes. And this creates a demand shock that lasts until the second quarter of 2021. I'm talking about next year and close to mid next year. Health systems are overwhelmed in many countries, especially the poorest, with large-scale human and economic impact. The epidemiological scenario is to the right. I'm not going to read it, but let me just mention that the virus is not seasonal, and that we perhaps see a mutated virus. I'm reading the second sentence to the right. And that mutated virus shows a resurgence in the fall of 2020, leading to a spike in cases across geographies throughout those months and beyond. Now, the US has become the epicenter, while Southeast and South Asia and Africa are spared worse effects due to the warm climates. Perhaps that is still with a question mark, but definitely due to their young demographics. We have learned from the experts, the medical experts, the epidemiologists, that young people they are not immune, but they have a high resistance as compared to older people like myself. Europe, China, and East Asian countries face a surge of reinfection as a result of attempts to restart economic activity and ease the lockdown. So people go back to normal and get infected again. Next, please. In this scenario of a prolonged recovery, there is a double dip slowdown as the economic recovery is derailed in 2020 and pushed into the first quarter of 2021. The US and Europe experienced demand-side reductions in consumer and business spending and deep recessions in this year. Layoffs and bankruptcies in the most affected sectors rise sharply throughout this year, 2020, feeding into a self-reinforcing downward spiral that takes us to 2021. Financial system distress is significant, but a full-scale banking crisis is averted due to better capitalization of banks, as we learned from the previous crisis, I say, and new macroprudential supervision that is in place. Is perhaps not perfect, as some people recommended, but it's a lot stronger than what it was before 2008. Fiscal and monetary policy responses prove insufficient to break the headwinds, and the global economic impact is severe, with significant GDP contraction in most major economies in 2020 and a slow-moving recovery beginning only in the second quarter of 2021. So if we go to the next, you will see the actual numbers as projected by several multilateral financial institutions. Negative economic contractions through GDP loss, which is the reduced output and productivity of countries and regions, happens across all regions of the world. And there you see the numbers actually in billions. In the case of Africa, sub-Saharan Africa is in the case of trillion, 20 trillion, 47 in the Middle East and Africa, and 290 in the European Union. Next, please. This message from the IMF, the International Monetary Fund, really shocks everyone, but is actually a little too positive in my humble opinion. I come from Ecuador, and I was a cabinet member that led the economy of my country. So Ms. Geeta Gopinath, chief economist of the IMF, says the Great Lockdown will result in the worst recessions in the Great Depression. I do follow those numbers because of the previous experience that I had in my career, and several people, and I tend to agree with them, will think that this scenario could get worse. Under the assumption that the pandemic peaks in most countries in the second quarter of this year and then recedes in the second half of this year, IMF is projecting global growth in 2020 to fall to -3%. And if you compare that with what happened with the global financial crisis in 2009, really you see the difference. With everything that happened during the global financial crisis of 2009, only 0.1% of the global GDP decreased, as opposed to 3%, not 0.3, but 3.0%. So that's what the IMF forecasts so far. Next, please. Here, the IMF shows us in a graph that deep down in the negative area that says April 2020. But then you also see the recovery in a scenario in which next year we are actually improving in 2021 and the economy rebound to 5.8%. However, this is only a partial recovery from pre-crisis projections because the cumulative output loss over 2020 and 2021 from the pandemic could be around $9 trillion. So it's very complicated. As I mentioned, the IMF is already forecasting a decrease of 3%. Next, please. Here, I'm going to accelerate now because we are running out of time and I must do time management. There are several lessons from public policies that we have learned, but this is just a small call of attention towards the sustainable development process that the whole planet has undertaken since the Sustainable Development Goals were adopted, and even before with the Millennium Development Goals. But since 2016 till now, very many people, imperfect as this process is, very many people have been lifted out of poverty. This thing is putting them back to where they were and worse. And we will recommend, of course, that the world does not lose attention of the sustainable development process and of protecting the poor and the vulnerable and the widow and the orphan and the migrant and the refugee. That's why we propose here, because there is interagency coordination at the national level that is needed, and harmonization at the regional and global level. That should become a priority. Next, please. In economic measures, resilience must become a priority for states, both nationally and locally. I like this definition of resilience that I learned from a prestigious speaker many years back. I think I was a young professional. He gave the example of a tree and moved by the wind, very strong winds that almost break the trees and bend the branches. But when the wind current ceases, the branch go back to normal. That's resilience. It's a beautiful definition. We would like our countries to go back to normal as soon as possible, and for that, economic measures should be taken. Some countries have established mechanisms for injecting current flows into the real economy through emergency bonds and loans, while others have developed public policies dispensing aggressive subsidies, very much needed, and payment of public services and rents and so on. It is assumed that the world will face a similar post-World War II scenario. So placing funds in the global economy will be necessary and urgent, not only to rescue companies and protect employment and stabilize supply chains, but also to reduce inequalities and guarantee public services. The UN and several other organizations have called for the cancellation of sovereign debts of underdeveloped countries, and increased international financial cooperation will be indispensable. Next, please. There are several social measures. I won't cover them because the speakers will be talking about it in a more practical manner, but the establishment of new public-private partnerships to provide social services is also important, in addition to social measures as the lockdown, for lack of a better name, and the social distancing. We also need to ensure a public-private partnership to provide social services to the most excluded populations. Next, please. Here you see some ruminations on the impact on Africa, and the next one is the last, the impact perhaps in Europe. But at a glance, because the speakers will be expanded on this, an initial analysis of COVID-19's economic impact finds that Africans are most affected in terms of GDP growth, because in the year 2020, the decrease will be from 3 to 8 percentage points. So as a whole, The IMF is projecting that the world economy will be decreasing 3% by December. In the case of Africa, depending on the simulation and the scenario, it could be as high as 8% of total GDP for the continent. To this, you have to add the dip in oil prices. I also follow that closely in my own country, who was a member of OPEC until last December. Ecuador is really suffering as any oil exporting country. 2 days ago, the price of the barrel that we export was $1, 1.02 cents, $1.02. So this, of course, affects very many oil exporting countries in Africa as well. An extensive stimulus package will be essential to reverse economic damages of the crisis, but I'm stating the obvious. And next is the last slide that I have, and it's for Europe. Estimates based on occupational level data suggest that the COVID-19 crisis could leave up to 59 million jobs at risk in this continent alone, in Europe, with the level of risk varying greatly amongst occupations and industries and countries. Europe must avoid the significant rise in unemployment witnessed during the 2008-2009 financial crisis, of which it took almost 10 years, almost a decade, for labor markets to recover from. COVID-19 has since had a significant impact on the economy, with reduced discretionary spending and consumer confidence, putting many companies in a precarious position. So I won't read what is to the right, but there remain many economic challenges in Europe. And just I will add one last thing, which is that even with the social welfare systems that the European countries will have, the unemployment insurance and the like, even with that, there are very many people suffering here as well. There are many migrants that cannot access these type of subsidies because they don't have a regular migrant status, not to mention refugees, even though they normally are registered. It's a very difficult scenario in a continent in Europe that is wealthy, that have very many resources to offer to the suffering population. The case of Africa, with very rare exceptions, is not the same, and we will dwell into that. So with that, let me stop there. And I had only 25 minutes. I went a little over. My apologies for that. But we wanted to give you an overview of what has happened as a whole with this pandemic in the world, and particularly where we are now. So let's go to the next slide, and let me have the privilege of introducing my colleague, Dr. Mpilo Guvane, based in Durban, South Africa, who's the director of the United Nations Training Center there, is affiliated to UNITAR, called CIFAL Durban, and also a government official working with the local government of Equini municipality, which is part of Durban. With that, Dr. Guvane, I would like to offer you the floor. Welcome.
Thank you very much, Alex.
Absolutely.
Greetings to all of you colleagues and all the participants who are participating in this webinar. I would like to start my little presentation by saying that as a country, we are very grateful of the wise words of encouragement that we got from the WHO yesterday, which hailed our strategy in dealing with COVID-19 as working. And in particular, they highlighted that what has impressed them is the fact that the infection rate in the country is still at 2.7%. But then the question would be, what is it that we are doing that is helping us to achieve this? I will just quote what one of our chief medical advisors, the person who is advising our Minister of Health, Professor Karim, pointed out as the main reason. He said, South African government is very lucky to have government that is listening and taking advices and implements those advices from the scientists and experts. I think that is one very important point to emphasize, that we are here or where we are currently because our government has been able to listen to the experts who were advising them on how to contain the virus. And part of that advice, which is something that is working very well for the country, is the lockdown. We are almost towards the end of the first month on lockdown, but we will have another week of lockdown up to the end of April, or another 2 weeks up to the end of April. But if you look at the background of the country, South Africa, the population is 60 million, and currently we have about 4 million of that population residing in our city, which is Durban. Those are just rounded off estimates. But as at yesterday, which was the 22nd of April, we had already conducted 133,000 tests, and 3,635 are positive. And the rate of death is at 65. Only 65 people have died as of yesterday. And the average of infection on daily basis is around 137. These numbers, even though they are pleasing in terms of containment, we still believe that there is still a long way to go. Hence, we are confined into the response that is depicted in the next slide as the stages that we have used to guide us. And these stages are 8. My Honorable Professor Saloshni Naidu, who is my co-presenter, will be able to give you the details of what has happened in each of these stages. But this is very important because it maps out the way forward in terms of how we are dealing with this. And another thing that I want to emphasize with regard to these stages is the fact that it doesn't really mean that after finishing one stage, we then move to the other stage. Most of them will have to go concurrently. If I were to make an example of lockdown, which is stage number 3, you will see that lockdown, although it has already started, is not going to be stopped soon, but we are going to have what we call partial lockdown, opening some sectors of the economy, opening some sectors of the government services, and so on. And the anticipation is that we will always have some form of lockdown up to September this year, or even beyond September this year. But in terms of what has been achieved overall, from stage 1 up to stage 5, we have done quite a lot of work, and we are currently intensifying screening. But we already know what our hotspots are as depicted in stage 5, and there is a plan to deal with those. But as I indicated, I think lockdown has helped us a great deal. However, we must also indicate that it doesn't go without challenges. As you will know, there will be people who are defying lockdown regulations. I think as of yesterday, we had already, we had about 1,000 people who were already arrested for breaking the lockdown rules, which is a huge number. But also what is becoming a problem is in terms of, like Alex was saying, the hunger that comes with the virus. We are seeing a lot of people who are queuing for the food parcels from government. And because of lockdown, a lot of our people, especially those who are poor, are dependent either on handouts or they get piece jobs here and there and get something to eat. But because of lockdown, that is highly impossible. So we have about 10 million people who are now struck by the fact that there is lockdown and they don't have food on their tables. At this stage, I would like just to save time and acknowledge and conclude by acknowledging and thanking Professor Karim, who is our Chief Advisor to the Minister, Professor Saloshni Naidu, that I'm going to introduce very soon. She is responsible for our province in KwaZulu-Natal and also the University of KwaZulu-Natal and National Department of Health. They have made a contribution to this presentation. At this stage, I would like to introduce Professor Saloshni Naidu. She is the head of department in one of our local universities for public health medicine, and is also part of the group that is advising our premier in the province, and is also part of that national committee that is led by Professor Karim in terms of coordinating provincial information about the virus. Thank you very much. I will now hand over to Professor Naidu.
Thank you.
Thank you very much. I just want to correct something. I'm providing technical advice to the Provincial Department of Health in KwaZulu-Natal and the eThekwini District Health as well. Thank you very much for having me, and I'm going to speak to the different stages of the COVID response, and this is acknowledging Professor Abdul Karim and the National Minister of Health and their presentation that they gave to the nation just over a week ago. And as Dr. Ngubane said, we have 8 different stages to our epidemic. What has really been positive in the country is the public health approach that we've taken to addressing this epidemic. If you look at the slide, you'll see that our very first case 0, was identified on the 5th of March. And at about the 10th of April, we had about 1,900 cases. Today, we're on the 23rd of April, and we have about 3,635 cases. So it tells you the number of cases are increasing. Prior to our case 0, we did start with a preparation phase with respect to our COVID-19 response. And subsequent to that, as the number of cases increased, you found that the rest of our public health interventions have been kicking in. Can I have the next slide? So our first stage of the public health response was to focus on preparation. And so preparing the country and preparing the nation for COVID-19 in terms of mass community education through various media channels about the disease and how to prevent it. Our national health and laboratory system started to establish capacity for diagnosis of the virus at a national level at the National Institute of Communicable Diseases. And also, they were starting to identify labs within the different provinces to build capacity for establishing testing capacity within the various provinces. At this stage, our surveillance program was slightly more passive in that we had travelers coming into the country from communities or from countries where there was extensive community spread of the virus. They presented with illness, were diagnosed, and then we actively traced their contacts. And so this was a passive method of surveillance. The second stage to our public health approach was primary prevention. And this was around teaching people about social distancing, hand washing and cough etiquette, but also implementing this within the environments we found ourselves, whether it was in healthcare facilities or in your supermarkets, in schools and universities. We then embarked on a process of where we actually closed schools and put a control on the size of gatherings, particularly religious gatherings. We limited the attendance to less than 100 people. And if you were in an Itiqueni municipality like us, our managers went further and actually reduced these gathering sizes to less than 50. They put a ban on weddings. And then we also closed our borders to international travel and put into place a process of where if South Africans entered the country, they had to go into self-quarantine and be tested as well. And then as the number of cases started to increase, we went into a lockdown on the 26th of March. And as Dr. Ngobane has said, this lockdown was supposed to end last week on the 16th of April, but it's been extended to the 30th of April. And today our president will address the nation, and we expect and anticipate to hear about a phased reopening of the country. The whole intention of the lockdown was to intensify curtailment of human interaction and to control individual movement between and within areas. And so within the provinces as well, we limited movement, and domestic travel was also abandoned. Well, we controlled domestic travel, and then we stopped domestic air travel within the country as well. Next slide. Next slide, please. Okay, so together with the lockdown, the lockdown gave us time and has given us time to strengthen other aspects of our public health intervention. And these are focused on surveillance and active case finding. So we've now moved from a passive form of case finding to an active form of case finding. We have trained more than 28,000 community health workers throughout the country who are based at ward level and who are doing door-to-door screening of individuals and then referring them for testing to mobile units. Those who are identified as positive, we then do contact tracing of their contacts, close contacts. We are screening at all healthcare facilities. On the entrance into healthcare facilities, we have COVID units set up within all of our healthcare facilities to further assess individuals and to test. In those places of essential employment, which is still functioning within the country, we also have active screening in those places of employment. And this will continue as we go into a phase of releasing on the lockdown. We also have, based on epidemiological data throughout the country, working with key scientists within the country, identified hotspots in the different health districts and in the different provinces. And in these hotspots, we are actually doing active community screening. And we also are, in some of these areas, we have intensified lockdown. So, for example, in Itiqueni, in KwaZulu-Natal, it is the epicenter for us in this province because we have the most number of cases for this province. So there's an intensified lockdown in Itiqueni, a control in terms of movement of individuals within the suburbs in specific areas in Itiqueni. We also are working with a GIS specialist and doing spatial monitoring of the new cases within the province and also nationally. And part of the reason for doing this is to identify where the new cases are so that we can respond and actually intervene early enough. But it also gives us an idea of how this epidemic is evolving within the community. We've had cases of outbreaks within nosocomial outbreaks within hospitals. And our concern is that these nosocomial outbreaks are actually going to fuel community transmission. Because remember, our healthcare workers go back into, most of them live in the communities surrounding the hospitals. They travel back into these communities, and then they can become a case for potentially spreading in the community. So we want to actually contain these outbreaks. And so there's intensive investigation of these outbreaks and intervention teams which plot and map the outbreak so that we're able to control the spread of it. Next slide, please.
If I may, Professor, and I'm greatly enjoying your presentation, quite relevant and specific. But kindly, if you can accelerate a little about the next phases, that would be much appreciated.
Yes,
thank you so much.
Yes, I will. So the next two phases, which are also happening concurrently, is stage 6 and 7, where it's more about the medical care. So we've had lockdown, we've controlled the epidemic to some extent. We acknowledge that we're not going to completely escape the peak, and we are going to have the peak. And so what we are doing is looking at building field hospitals for triaging of our asymptomatic and mild cases. We're expanding ICU bed and ventilator numbers throughout the country. And then we are managing, we have quite an intensive occupational health program to manage staff exposures. We in terms of the 7th stage, and this is around issues of bereavement and aftermath. So we have provided regulations on how to deal with funerals and the deceased. And throughout the country, we've got mental health experts who have come together and who are providing support to the general public and to healthcare workers as well. And the final slide, please. Okay, so, no, sorry, the one before, sorry. Yes, so the last stage is about ongoing vigilance, and this, we intend to use antibody tests as soon as they're available to monitor antibody levels within the population. We are administering the flu vaccine to people over the age of 60 and vulnerable individuals. And we're going to continue with surveillance. So besides doing house-to-house screening and testing, we're going to do random sampling in special high-risk groups, like your healthcare workers, schools, universities, mining communities and prisons, and also in industry. And this will continue well beyond September, so that we can have an idea of what's happening, but also more importantly, so that we're able to control the pandemic as it grows within our country. In terms of the lockdown, as Dr. Ngobane said, we're going to have a control lockdown. So there's a lot going into advising people of the age of 60 to actually minimize the time that they spend away from home. We're also working with NGOs to look at how best we can support older people in terms of getting their daily groceries and needs sorted out as well. Okay, the next slide, the final slide. So the point I want to make here is that all of these steps or stages to our response has been ongoing, and they overlap with each other. So the lockdown will carry on, partial lockdown will carry on to about September. We're going to continue with primary prevention, and we'll continue with our vigilance and our hotspot monitoring. Okay, so that in a nutshell is the public health response that we've put into place. Thank you.
Thank you very, very much, Professor. This is quite impressive. And as I say, very specific. You have given us an excellent overview of how South Africa is going through the crisis in all these stages. And also, thank you to Dr. Mpilo for the numbers and the comments at the beginning. So we will have at the end of this webinar, so the opportunity to address some of the questions, and one of them is to both of you on the balance between the lockdown and the economy, but that will be later. Thank you again. Now, it is my great pleasure to move from South Africa to Senegal and to give the floor to my colleague, Dr. Mohamed Diop, the director of CIFAL Dakar, and also a government official working with the government of the city of Dakar. Mohamed, the floor is yours. And by the way, Mohamed will be speaking in French, but with translation provided by our colleague, Julia, who is ready. Go ahead, Mohamed, please.
Merci, Alex. Bonjour, c'est Mohamed Diop, directeur de CIFAL Dakar. Je voudrais en tout cas remercier l'UNITAR pour cette initiative et le réseau mondial du CIFAL, ainsi que tous les participants qui sont dans le webinaire. Donc, comme vous l'avez dit, cette pandémie touche aussi bien les pays européens, asiatiques que les pays africains, sauf que nous, en Afrique, jusqu'à présent, nous n'avons pas, en tout cas, connu la gravité qu'on note dans d'autres pays. Donc, le Sénégal aussi, comme tous les pays, est confronté à cette situation. Donc, pour aujourd'hui, la situation aujourd'hui, c'est 479 cas, donc 257 guéris, 215 sous traitement, 6 décès et 1 évacué.
Hello. As we all know that in this world, the pandemic is currently touching every country and every region and everybody. In Africa, we have not experienced the outbreak as strongly yet. However, we are taking the measures into hands, and we have experienced 6 deaths in Senegal so far, 257 cared for, and 215 are now in treatment.
Voilà. Donc, comme dans tous les pays, lorsque la pandémie s'est déclarée, l'État du Sénégal a pris les dispositions nécessaires pour endiguer cette épidémie. Et donc, nous, en tant que CIFAL Dakar, nous allons beaucoup plus insister sur la stratégie qu'a menée la ville de Dakar. Mais cette stratégie rentre en étroite ligne avec ce qu'a décidé l'État du Sénégal, à savoir des mesures économiques qui peut-être seront développé par M. Abambey, qui est le directeur de la DAS.
Senegal has taken the necessary steps of action, and one of the strategies of the city of Dakar is with economic measures that will be further explained later by our expert from Senegal.
Donc, la première mesure, c'est que le président de la République a aussitôt convoqué, en tout cas, toutes les parties prenantes, l'opposition, la société civile, le secteur privé, pour voir comment, en tout cas, endiguer cette maladie en mettant sur la table une enveloppe de 1000 milliards pour soutenir les industries, la diaspora, par la suite l'achat de vivres pour toutes les couches défavorisées. On a aussi fermé les frontières, aussi bien terrestres qu'aériennes. On a arrêté les écoles, fermé les écoles, les universités, les lieux de culte. On a aussi déclaré le couvre-feu et l'état d'urgence. Il y a des comités qui ont été mis sur pied pour suivre cas par cas les contaminés, des mesures d'ordre social telles que les mesures de grâce pour désengorger les prisons. Plus de 2000 personnes ont été graciées. En tout cas, il y a autant de mesures qui ont été prises par l'État du Sénégal pour venir à bout de cette pandémie. Et maintenant, la ville de Dakar, à travers la direction de l'action sociale, qui a comme domaine d'intervention la santé, donc a pris en exergue tous ces aspects que l'État du Sénégal a développés pour, en tout cas, essayer d'aider les populations de Dakar.
Senegal is taking all of the measures necessary by also involving all of the sectors to leave no one behind. This means that they have closed borders, schools, cultural grounds, as many other countries have done. They have declared an emergency state and are now following case by case each COVID case to take the necessary measures to reduce the number of cases.
Voilà, maintenant je vais introduire M. Abambey, qui est le directeur de l'action sanitaire de la ville de Dakar, pour qu'il explique la riposte de la ville de Dakar dans cette pandémie qui s'inscrit en étroite ligne avec ce qu'a fait la ville de Dakar, avec ce qu'a fait l'État du Sénégal.
And now we would like to introduce our next speaker, who is a representative of the mission of Health, Social Action and Assistance to People in Senegal.
Thank you very much, Dr. Diop, and welcome, Mr. Mbaye. Go ahead, please.
Merci beaucoup, merci beaucoup. Merci, c'est un plaisir pour la DAS d'assister à ce séminaire. Comme Dr. Diop, je vais parler, faire la présentation en français. Si on peut voir le prochain slide, please. Voilà, le premier slide, il présente un peu Dakar. Aujourd'hui, Dakar, qui est la capitale du Sénégal, est devenu l'épicentre du virus. Aujourd'hui, le maximum de cas qu'on a figure au niveau de la capitale, puisque comme vous pouvez le voir au niveau des chiffres, Dakar, c'est 0,03% du territoire du Sénégal, mais c'est 90% des activités économiques, c'est plus de 30% de la démographie. Donc, le cœur du Sénégal, c'est Dakar. Le cœur administratif, le cœur industriel, le cœur économique et l'essentiel des activités du pays se déroulent à Dakar. Donc, on peut aisément comprendre pourquoi, très rapidement, Dakar est devenu le point de convergence de ce virus-là avec un nombre de malades le plus élevé sur le territoire national.
The first slide presents the city of Dakar, which is the heart of Senegal, because 90% of all economic activity and other activities are being done and held in Dakar. It is also the epicenter of the virus currently.
Merci. Prochain slide, s'il vous plaît. Le docteur Diop l'a clairement expliqué. On a un double niveau de responsabilité. Le premier niveau de responsabilité, c'est l'État du Sénégal. C'est le ministère de la Santé et de l'Action sociale qui coordonne l'ensemble de la riposte concernant le COVID-19. Donc, le niveau de coordination, aussi bien sanitaire que social, se fait au niveau du ministère de la Santé. Et l'État a mis en place un fonds qui s'appelle Force COVID-19, qui est un fonds de plus de 1000 milliards, qui est un fonds de riposte contre les effets induits par le COVID-19 sur la situation économique, sociale du pays. Donc, nous, on a une stratégie en interne qu'on a développée, mais qui vient s'ajouter à celle que l'État a déjà mise en œuvre.
One of the first responsibilities to fight this pandemic is coming from the Ministry of Health and Social Action. They have applied a forced COVID-19 front to aid the social economical situation that is currently happening.
Okay. Prochain slide, s'il vous plaît. Alors, la première chose que nous avons eu à faire, c'est que nous avons pris sur notre budget, le budget de la ville de Dakar, au niveau du... Nous avons versé... Il y a un problème?
No, go ahead, please.
Thank you. La première action que nous avons faite, c'est que nous avons pris 100 millions de francs CFA que nous avons versés au niveau du fonds Force COVID-19. C'est une contribution de la ville de Dakar parce que nous sommes la capitale du Sénégal et nous avons considéré que si l'État du Sénégal lance une guerre contre un virus qui a des conséquences non négligeables sur la situation économique, Dakar, en tant que capitale, au nom des Dakarois, doit faire un effort à la guerre, doit faire un effort à la lutte nationale. Donc, c'est une première contribution financière que nous avons fait sur notre budget de 100 millions de francs CFA qui est reversé au niveau du fonds Force COVID-19 qui a été mis en place par l'État du Sénégal. La deuxième chose que nous avons eu à faire, c'est que nous avons pris l'ensemble des centres de santé que vous avez à Dakar et qu'on a réfectionné, qu'on a restauré et qu'on a mis à la disposition de l'État. Parce qu'il est important de dire que Dakar a 19 communes d'arrondissement et il y a des communes d'arrondissement qui ont beaucoup plus de démographie que d'autres. Si le virus explose au Sénégal ou explose à Dakar comme il l'a fait en France, aux États-Unis ou en Italie, nos hôpitaux n'ont pas les moyens logistiques de faire face à une telle demande. Donc, il était important pour nous de permettre à l'État d'utiliser nos centres de santé comme zone de mise en quarantaine, d'utiliser nos centres de santé comme zone de repli au cas où le virus arriverait à exploser, atteindrait des quantités non gérables pour le pays.
Two measures have been taken to fight the consequences of the virus. The first one was a check of 100 million FCFA that was handed over to the Central State and Ministry of Health to support the forced COVID-19 fund. The second action was, in case the virus would explode like it did in other countries so far, the hospitals in Dakar would not be able to take care of all of the patients. So with that, one of the most important steps that they have taken was to convert their health centers to for quarantine purposes.
Next slide, please. L'autre action que nous avons menée, c'est que comme pour l'instant, nos hôpitaux arrivent à tenir le coup, il était important de les appuyer en matériel sanitaire. Donc, l'État du Sénégal a référencé au niveau de Dakar 4 grands hôpitaux. Nous avons choisi les 8 plus grands hôpitaux et nous les avons renforcés. Et nous avons parti d'une liste, d'une demande faite par les hôpitaux pour les équiper, pour leur fournir un matériel. Donc, nous avons renforcé l'ensemble des hôpitaux de Dakar pour faire face à la crise. Et c'est du matériel, c'est du gel hydroalcoolique, c'est des draps de lit, c'est du matériel de santé en quantité non négligeable que nous avons fourni aux hôpitaux de Dakar pour les permettre de tenir le coup par rapport à cette situation qui risque de s'envenimer. Bien entendu, comme tous les autres pays, nous avons fait face à ce questionnement. Est-ce que nous allons vers le confinement ou pas, comme on a eu à le faire dans d'autres pays? Nous avons considéré que faire le confinement au Sénégal n'est pas applicable puisque nos économies sont totalement informelles. Les gens se lèvent le matin, vont chercher de quoi vivre pour le lendemain. Aujourd'hui, il y a des pans entiers de l'économie qui sont à l'arrêt. La restauration, le transport, le tourisme, qui sont des secteurs fortement impactés. Donc, comment aider les populations à rester à la maison puisque nous avons un semi-confinement, il y a un couvre-feu à partir de 20h du soir jusqu'à 6h du matin. Comment aider les populations à faire face? Comment aider les populations à tenir le coup? La ville de Dakar a anticipé en achetant des denrées alimentaires. C'est des quantités de riz, de sucre ou d'autres aliments que les populations utilisent au quotidien, que nous avons acquis en grande quantité pour les offrir aux populations et permettre à ceux qui ne peuvent plus travailler d'avoir un soutien et permettre à ceux qui n'ont pas les moyens de se nourrir, de pouvoir se nourrir tout en restant chez eux. Nous demandons aux populations de rester chez eux, mais rester chez soi est difficile si on n'a pas de quoi nourrir sa famille. Donc, la deuxième stratégie, après avoir équipé les hôpitaux de Dakar, est de faire en sorte que la famine ne s'installe pas dans les foyers de Dakar.
Two strategies have been put in place to support the health structures, municipalities, and populations. The first one is provision of equipment, of healthcare and materials for hospitals. And the second one was distribution of food to the 19 communes and the modest populations in Dakar, as Dakar is currently facing a semi-confinement, as a lot of people have day jobs and they are very highly impacted, and it is not feasible to do a total lockdown. So it is recommended for the people to stay at home. However, if they do need to leave, they will do have help to receive food and other provisions.
And if I may, Mr. Director, you are doing a great job, but I hope you understand me. I kindly ask you to accelerate a little because we're running out of time, please.
Okay, thank you. This one is the last slide because
Okay.
La dernière action que nous avons mise en place, c'est qu'il faut désinfecter les rues de Dakar, il faut désinfecter les bâtiments publics, il faut désinfecter l'ensemble des lieux recevant du public. Donc, voici de manière schématisée l'ensemble des actions que la ville de Dakar a eu à mener. Un appui financier à l'État, un appui aux hôpitaux de Dakar, la désinfection en masse avec une distribution en grande quantité de produits d'hygiène et faire face à la famine qui risque de s'implanter en Afrique. Le plus grand danger aujourd'hui qu'on a, c'est qu'on demande aux gens de rester chez eux, mais si on continue à rester chez nous, ce ne sera plus le COVID-19 le problème de l'Afrique, mais ce sera la famine. Thank you.
One of the biggest problems Dakar will be facing is the economic consequences of the virus, which they are now trying to reduce by disinfecting methods, the provision of masks and gloves and disinfection materials, as well as the financial aid and food provisions. Thank you.
We have this last one on the protection of homeless children. You can read the text on the screen. In partnership with the Fondation de Port, the Ville of Dakar is providing socio-cultural centers and transit space for homeless children. But with that, I would like to thank our colleague, the Director of Health, Social Action and Assistance to People of La Ville de Dakar. Excellent presentation. So thank you very much, Mr. Valle. And the same goes to Dr. Diop. Very good. We will go now from the case of Senegal to the case of Turkey. And for that, I would like to have the pleasure of inviting my colleague, Professor Ahmed Aydemir, who is the director of the UNITAR Training Center in Istanbul called CIFAL Istanbul, and also a professor at BAU University. Dr. Aydemir, the floor is yours.
Thank you, Alex. Hello, everyone. As the director of CIFAL Istanbul, I salute you all from Turkey and hope that you are safe and in good health during these challenging times. I would first like to mention that today is of utmost importance to Turkey because it is the 100th anniversary of the National Sovereignty and Children's Day, which commemorates the foundation of the Grand National Assembly by Mustafa Kemal Atatürk, our founder. And though we would like to go celebrate outside, we can't do that because of the virus. Now, as we can see from the World Health Organization's map of the world, the world is going through a challenging time because of all the cases and all the deaths, and the same is going for each country as well, and Turkey is one of them, of course. Next slide, please. When we look at the map for Turkey, we see that though there are many cases of the pandemic, the numbers are relatively under control, and this is in big part due to the application of early precautions, which I will briefly be mentioning now. The next slide, please. For the precautions taken by the health sector, the Ministry of Health acted proactively, started from January. And within the framework of planning healthcare system capacity, Turkey introduced changes to its healthcare system before even the first case was detected. So what happened was public and private hospitals with adequate personnel numbers and physical infrastructure were designated as pandemic hospitals. Intensive care capacity was increased. Joint effort was initiated with the private and public sector to manufacture ventilators. Also, training modules were developed for all healthcare workers, and all of them were trained by the time the first case was discovered in Turkey. Aside from all these, all health services, including testing and treatment, were offered free of charge in line with universal health coverage and the leave no one behind principle. Next slide, please. Regarding public precautions and sanctions, a curfew was imposed for people below 20 and over 65 years of age. Weekend and holiday curfews were also introduced throughout the country for all citizens. And for those under the curfews, their needs were met by the government and the local administrators. Entry and exit bans were introduced to provinces with high case numbers, and severe travel and transportation restrictions were initiated all over the country. Similar to the actions Dr. Engubane and Ms. Naidu mentioned, all recreational areas and shopping malls were closed and mass gatherings were cancelled. And to minimize the risks faced by those who had to go outside, the use of masks in public areas were made mandatory, and the masks were actually given by the government to the people that are in need. Next slide, please. When we look at the education and professional sectors, we see that all educational institutions were closed right after the first case was discovered. Now, to close any gaps in education, distant learning modules were introduced. They were developed for a week, and then after a week later, all educational institutions were reopened digitally. In terms of working for the public sector, flexible working hours were introduced, and also shifts were introduced. And For the private sector, flexible working from home, and shifts were again highly encouraged. The next slide, please. A countrywide follow-up strategy was developed under the comprehensive contact tracing and stock planning. To manage this process, a scientific committee was created during early January, and from contact tracing to test strategy, all of the decisions that were taken by the government were shaped by the recommendation of this committee. Testing capacity was increased, and today I can say that the average number of tests performed daily is almost 40,000. The ministry successfully isolated the virus in the laboratories, and this gave a chance for further research in terms of vaccine and medicine development. They also developed a database for innovative COVID-19 related projects, and moreover, to fund and support these, Istanbul Development Agency initiated the COVID-19 Fight and Resilience Program to support these entrepreneurs and projects. Next slide, please. In terms of communication management, social media and broadcasting were widely used to inform the public, share accurate information. The Ministry of Health held almost daily to weekly briefings, while Ministry of Education and Internal Affairs and also the President held regular sessions informing the public. Editorials featuring influential and famous figures and actors, actresses were made to inform the public, and they were run in the major prime time of televisions. As we can see from these examples, Turkey was relatively successful in containing the virus and controlling the treatment and isolation procedures. However, we must accept that we still have a long way to go before the virus is over and we can actually relax in terms of the sanctions. I also agree with Mr. Meha that the economic outlook might also be here for a long time to come, even after the virus ends, and that we must make all haste to recover it as much as we can. But of course, we're hoping that the outlook will be better following summer 2020. The next slide, please. I thank all of you for listening. Thank the UNITAR team for such a great organization. And now leave the floor to my colleague, Professor Ebujana Sokuldu.
Thank you.
Professor, can you hear us?
Yeah.
Yes, go ahead, please.
All right, thank you very much. I think all the panelists before me, they were all very enlightening, and they gave us very important insights from country-specific how this COVID-19 pandemic with the national state. And I would like to draw your attention to the between the international governance. And recently we have heard about, for instance, the World Health Organization with the pandemics, right? And I would like to actually invite your attention to certain criticisms also on the side of nation states in dealing with the pandemics and maybe not complying with the international commitments, right? International and there's a loose of informing the nations of play, right? And following up before, sorry.
Me voy a pasar otro cuarto, no sé, bien.
It seems that we are having communication problems.
And in the form of the organization. Can you hear me?
Yes, but you are coming on and off. Are you off your video?
Well, not really. I'm actually.
Yeah, I think it would be better if you stop your video and you just do this via voice. And if you just continue with the presentation, you tell us when to put the next slide. Is that okay?
That's okay, of course.
Go ahead.
So, all right, if you can hear me, there is no problem.
Yes.
Well, so basically the World Health Organization was, since the League of Nations Health Organization is the most widespread international organization that deals with health-related issues at the international level, where all the member states are expected to commit, depending on the constitution. And the organ chapter 3, it says membership to all is essential. So, and basically the organization also sets the ground for, a state commitment to health for all people around the world, right? Slide, please. And what the nation states do for that? Well, basically from the governments, they also pay their membership fees. Basically the states pay with these membership fees to the organization to fund the health of all the international community. And next slide, please. Particularly the funds. Yeah, sorry, this slide. It's just a problem of synchronism. So, what do the states? They pay, like, for instance, among the largest WHO, we have Japan and the European Union and UK and China, that goes. And basically, state commitment for, again, the WHO to function is quite essential for the limits of the organization to function. All right. So this tells us, right here, what you see in this map is how stringent the government respond to, management of COVID-19 since the outbreak of the pandemics. Also, a month ago, we could see a lot of white areas which told us that Asian Africa is circles have joined to the stable management of the pandemics, and apparently national level or international level, why there have been a lack of support in terms of funding or in terms of medical equipments to the nation states. But this is important to pay attention to, is, no state can deal with such a pandemic alone. So that's why their international commitment is extremely, we consider pandemic as particularly is a security, it's a security issue for security aspects, security matters, and also definitely for international security matters. As recently the Spanish Minister of Foreign Affairs have stated in a tone, if we sink all, we will sink all, or if we float all, we will all float. So that's why the international commitment is extremely essential here. And there are political and economic some economic, the COVID-19 management, and I agree with him and he raised in terms of the political acts on state is very vulnerable in terms of how the pandemics has already started giving some political and economic damages in terms of recessions, in terms of being have not exposed. So that expect that alone every around that. And well, in population, over 3 billion.
Very good. So I think we couldn't hear you at the end of the presentation, but we do have the slides in front of us. And I want to thank you, Professor, for making the effort to make us understand something that is rather important, which is how all the multilateral architecture of the United Nations, but the rest of the what they call the multilateralism, interacts with national governments and even perhaps with some national and local governments. And these dilemmas that you present of how WHO actually does its work is important, because there are mechanisms of state control, as you say, that may prevent WHO from effectively doing what they are supposed to do. So let's conclude there. And I thank again, Professor and Dr. Aydemir for giving us this understanding of what is happening in Turkey, and particularly very interesting again for trying to understand all the forces that come in this dynamic, the WHO at the center of it all. But with that, thank you for the effort. We will move from Turkey to Spain. We have our colleague, the director of our United Nations Training Center in Malaga, Mr. Julio Andrade, who was also until rather recently the deputy mayor of the city of Malaga, with a long and illustrious career of more than 2 decades, the chief of police and then the deputy mayor of the city. So it is my great pleasure to welcome Julio Andrade to the floor.
Thank you, Ale. Good afternoon to everyone. I'm sorry for coming late. I was intervening about counterterrorism, nothing, very different issue. And so thanks for waiting me. Well, as probably all of you know, Spain is facing a really bad time. Before getting to Spain, I was having some figures about the world, the Europe and Spain. So, well, you can see here in this chart how Spain is the second country with confirmed positive cases, and 200,000. That's a lot for Spain compared to the size of the US, of the size of China, of other country. In Europe, France was the first European country affected, but as you can see, it is managing better the COVID-19, and almost everyone in Europe is facing 47 countries, and we don't have enough data about all of the countries, but of course, Spain, Italy, Germany, we are in the top ranking, sadly to say, in the top ranking. So, well, from this 2.5 was yesterday 2.6 million of total confirmed positive cases in the world. Next, please. Now, if we go to this rank, the rank of death, Spain is number 3 of the world with more than 100,000, 71,000 of all. I mean, and Spain has 21,000 today. It's still 21,000 more, 2,000 more deaths almost every day. It was at the beginning. Now we are increasing around 400, between 400 and 500 every day. Every day is we are moving steps little by little. So every day is just a bit better, but it's been very difficult still. Next, please. Well, here you can see the daily death toll, but also you can see how many days pass since any country started. As you can see here, Spain and France, we both almost started at the same time. Italy started like 1 week before. So we've always been looking to Italy and all the Italy measures. Now a little bit behind the US, but it's increasing really, really high, and the UK also. Germany has been doing very well since the very beginning, and there are other European countries that are not in the chart. And you can see China after 70 days, they're very low rates. So, well, we are still looking to Italy to see compared to them, but we think Spanish administration was really confident that if the COVID-19 was not going to struggle as much as it's doing to Spain, so probably measures were not taken before. And so it was sad because we had some very important events taking place during the first days of March. And probably these events were not going, should not have taken place, like big sport events with Italian football players and Italian people coming to Spain, to Madrid mainly, and some protests in the streets. So many different big events where many people was infected. Next, please. Well, this is a coronavirus situation in Europe. I was talking about Spain, but you can look to Portugal. They really have low rates. We all think in Europe, Portugal is managing very well the crisis. Probably is one of the champions of the management of the crisis in Europe. And I mean, it's good to say they realize they need to take very strong measures at the very beginning, where they really have very few positives, and they did a strong measure as Spain, but we did it later. So, and you can see other countries, and Switzerland, France, and Belgium, the UK is probably going to be, UK is going to pass Spain because they start managing measures very late. Next, please. Well, now in Spain, this is a chart where you can see the different regional areas of the country. So Madrid area is really doing worst, and they have more than 57,000 of cases. Catalonia has 43,000, but you can see the region where you live, Andalusia. Andalusia is the major region in Spain. Is the bigger population of Spain, Spanish region is Andalusia, and we are doing much better than Madrid. Well, there are some facts. We are not very sure because there are different things that would contribute to this. Madrid, of course, is the capital. Madrid airport is really important. Thousands and thousands of people were coming to Spain the early February at the beginning of March. So a lot of people could be mixing to other people, and so COVID was spreading really high. Catalonia, something similar, because Barcelona is a very touristical city. And inside, in the region, within the region of Andalusia, Malaga has a little bit more confirmation cases than others, also because we have an international airport, and probably we got also some cases from abroad, not local cases. Here you can see that in the country, in Spain, the first person affected was a German tourist. So we imported the virus, in this case, from a German person, and that I think he was in China before. That was at the end of January 2020. But as I was saying, we were not taking real measures till March. So we lost more than a month, being very weak, just giving some, the government, national government was just saying, well, social measures, be careful, but not really. There was not a strong commitment. There was not a crisis management team telling the people what to do every day. Not at that time. Next, please. Well, now a little bit talking about what's happening and what's going to happen. And for us, Spain is a country like most of European countries, but for Spain, economy is so important, and tourism is really important. It's 13% of our GDP. We are now looking to this, what is called European Recovery Fund, Marshall Plan, that is going to help us mainly in the tourism sector. But the affection is really high. As you can see, 90% of the airlines are not working, either the cruise line. More than 50% of hotels are closed. More than 70% of restaurants are closed. Everything really the damage is really huge. And if you were talking about region like our region or city like our city, we don't have an industrial sector. A bit of technological sector, but 90% of our sector is based on tourism. So our economy based on tourism are really facing a problem for the present and for the future. In the Spanish case, tourism accounts for more than 12% of the GDP. That means 2.62 million jobs. And that's a lot. That's 13% of the whole jobs in the country. So the impact is going to be really great. Economists were saying that if we still lock down by May, the GDP would decrease to 8%. But we already believe we are going to be almost locked down till June or July or August. So it's going to be from 10 to 12% of the GDP or even more. That's really huge. We are not going to have the chance to recover the country before 5 years. Even next year, we all think we are going to be getting a GDP increase around 5%. Is not going to be enough, and not at all. I mean, all of this employment now, we are going to have really almost 40% of unemployment in the country. How can you hold this, having not an important industrial corporation helping you? And you know, international tourism is going to be facing also problems, not only this year, probably till mid next year. And so it's going to be very difficult. Next, please. So we can really say that the Spanish economy has entered recession. Some economists say this is expected to be temporary, but other things is going to be forever. Things are not going to be the same in Spain forever, and we probably need to ask to the European Commission to save the country. And that happened to Portugal, happened to North Ireland, but never happened to Spain. So this is probably because the Spanish debt is really high so far. So now that we need to move into social help all over, we need to help support people that lost their employment. We need a lot of money, so that the money is just coming from increasing the debt. So this is going to be very hard for the country. So, we have now our expectation to see how the different level of activities can come starting again. But as I was saying, now till May 9th, everything is almost closed, and just essential services, public and private essential services. After May, some private sector would start, but would be very, very slow. They are even saying that we are not going to be able to go to the beach during July or August without restrictions measures. So things are like that. I mean, so now we were talking about a health problem, but really we have now a real huge social and economic problem. And we need to know how we can face it all together. How can we minimize the economic impact, and how we can really give the support to the most vulnerable groups. That is the most important thing. Next, please. I think that this is done. Thank you very much.
Yes, Julio, thank you as always for giving us an excellent overview of what is happening in Spain, and especially for taking us a little into the economic side of this crisis, because indeed we went from a public health crisis and pandemic to a social crisis to an economic crisis. Things are getting exacerbated. And in this particular sector, just to name one, and thanks again, Julio, tourism, you all understand that all the things that Julio mentioned cannot recover in a short time. This will take several months, if not until the end of the year, as we were saying in the different scenarios, or early next year. So that's a lot of people that depend on those jobs for a living. And it's very sad to see how this multidimensional crisis is evolving. But with that, I thank again Mr. Julio Andrade, Director of the CIFAL Center in the city of Malaga in Spain. And now it's my great pleasure to invite Professor Michael Hopkins, a great friend of the United Nations, former senior official of the United Nations, who's the co-founder of the Institute for Responsible Leadership in London, and adjunct professor at the International University in Geneva, and adjunct professor at the George Mason University in the US, and adjunct professor at the Indian Institute of Technology, and many other things that it will be too long to mention. but you will hear why it is a great privilege for UNITAR to have Professor Hopkins with us in this webinar. The floor is his, and he has a multifaceted diagnostic to give us in a very short time. So, Michael, welcome to, you have the floor now.
Thank you very much, Alex. I hope everybody can hear me. Just one comment just to begin with, before you maybe you could put up the first slide, please. I was absolutely fascinated with the presentations, and congratulations to UNITAR for putting together this series of seminars from different countries. I'm actually speaking to you from Nairobi in Kenya, and of course I've been here in fact for the last 6 months, and I've not been possible actually to leave to get back to Europe, where I spend about half my time. So I spend half my time here and half my time in Europe. But one thing is certain, is that all the African countries that I know of are struggling with the same issue. And I was particularly interested to know what South Africa and Senegal were doing, and also Turkey. And I just wonder, Alex, whether these presentations could be made available to representatives in each of these countries, but even more, whether somebody, one person in South Africa, for instance, perhaps the ambassador, would have good contacts with the ambassador in Kenya and could inform them of the sort of things that South Africa has been doing to control the pandemic, which seems to me very similar along the lines that Kenya has been doing, but perhaps a little bit more experience because they started beforehand. I think it would be very, very useful if the ambassadors of the respective countries could get together and inform each other. Or perhaps it could be a role for UNITAR. Anyway, I leave Alex, who's an ace politician, to sort that one out.
Thank you.
Let me go into, Alex asked me to briefly go over the situation in my own country, in the United Kingdom, in France, where I have a house just outside Geneva, and actually my son is in France at the moment. He spends his time between France and the United Kingdom, and actually he's in lockdown mode in France, which he doesn't mind about too much because he's in the south and the weather's very nice there. So we're in contact pretty daily on the situation that he's experiencing, and also my daughter, who's actually in Geneva, who tells me what's going on there too. Let me start off, as you see, with this picture, with the United Kingdom. And what's kind of interesting, if you look at the bottom right, I don't know if you can see it. Let me see with my thing. The bottom right is the United Kingdom, and you see it's leveling off here. This is a graph from the Financial Times, and I saw that the gentleman from Malaga was using a similar source. They're using these kind of logarithmic scales, which makes it a little bit biased in understanding. If that was the real numbers, the UK would be going straight up, not leveling off. But on the other hand, what it is showing in the UK, that they have around 1,000 deaths a day, far too many, and absolutely shocking. And so let me just start with the UK. Why is the UK in such a relatively bad situation? Almost the same curve as you see in the United States, which is it's the one just here. Well, we know about the United States. We're not talking about that today. But in the United Kingdom, probably a little bit like Spain, they started a little bit too late, I think, to recognize the situation. Normally, the UK has a very, very good national health system, but through cuts over the last 10 years of austerity, which has happened in many countries around the world, the health service, which is a public health service, suffered. And that possibly could be part of the blame, but also the UK is a rather crowded island, and population density higher than France and Spain, which could explain some of it, because London is also suffering. Also fairly high immigrant population, and immigration has, amongst immigrants, they've been having a tougher time of it, actually. probably because immigrants are forced to go out and intermingle and work, and they can't stay at home, even in a lockdown. Possibly part of that explanation. So that gives you an idea. Next slide, please. Next slide.
Yes, it's on the screen.
I can't see it. Oh, they said I'm having internet trouble, so I can't see the next slide. And so,
Yeah,
and
it's the
since
total confirmed
I don't
number
have
of cases and the deaths, 2.5 million and 170,000 deaths, and it's a map of the world. Go ahead.
okay, but I can't see the next slide actually, unfortunately, so I can't talk about it. And oh, I've got it now. Yes, sorry. Yes, yes. Just a comparison between the number of deaths and number of cases around the world. You can see that Spain and UK and France are more affected even than Germany, and getting up to the numbers in Italy. Well, we're not talking about Italy today, but more about France and the UK. Why did France accelerate so very quickly? I live near a ski resort, and I know that in the ski resort itself, the number of cases in the ski resort were much larger on average, given the density, than almost anywhere else. Is it because it's very cold there? Which leads me to another issue, which is are countries which are more temperate less likely to have serious cases of coronavirus? Where I am in Kenya and in Africa, we're hoping that's the case, that in a more semi-tropical area, that the number of cases will be less. But we've probably not seen that if we look across to Florida, which is also semi-tropical, as their cases have been bad. So going to France, as you can see, the number of cases are still rising quite rapidly. This is a linear scale, not the logarithmic scale that you saw from the Financial Times, which shows a leveling off. So it looked like in France is that the slope is still upwards, but slightly coming down in number of deaths. Could we have the next slide, please?
Go ahead. We have it.
Okay, you have it,
You have
and
it
I
up
haven't.
we see it immediately.
Okay,
Yes.
sorry.
This
Yes.
is COVID response.
Okay, this one I haven't even seen. This has been the response, the main response. I can't go into the detail that my other colleagues went into, but certainly there's a nationwide curfew, and with permission needed to leave your house. In fact, one of the reasons I can't go back to France, it's not clear I can cross the border in order to go to my house in France, because they're going to ask me, where have you come from and have you had a test and so on, and it's very difficult to have a test here. Certainly in France, social distancing is enforced. It was interesting from South Africa that there it's actually enforced through the law. I'm not so sure about in France whether that's the case. I think it certainly should be. In Kenya, it's not, except you do see it in supermarkets and so on, social distancing. And in fact, you find in Kenya that about half the people that you come across don't observe social distancing. I have this empirical analysis I do when I'm running, and I count how many people keeping away from me. Normally, it's a good thing to do, I would say. But also how many people are wearing face masks. And I run every day, and I find normally that there are more people not wearing face masks than do. It is compulsory inside stores, but outside where it's also needed, it's not compulsory. There was some confusion, as you remember, in the beginning of the year with WHO directives. Not their fault really, because we're all learning, I think, as we go along, and the science is trying to keep up with it. In France, certainly they've closed borders without exceptions. I think some people listening would know much better than I about going from France into Switzerland, and they've certainly stopped flights. Next slide, please. So this is information from France that it's on its 38th day of confinement. Here in Kenya, we're on our 30th day, but we've actually voluntarily confined ourselves. We're not necessarily asked to do that, except from 7 in the evening until 5 in the morning. I hope I'm not confusing you by jumping from one country to another, but it's a little bit problem, probably with my computer and the internet here, and the slides are not coming up so quickly. Anyway, this gives you some of the response from France on a number of issues, and my feeling is that they're handling the situation quite well. Nobody likes to be confined at home, and we see the liberalization a little bit coming along, especially in schools. We heard that. Also, I heard that in UK, a little bit of liberalization there too. The problem is, of course, when you start liberalizing, there's more contact with people. I think if they're wearing masks and they wash their hands, that really does help. The problem, of course, is that the economy suffers. When you keep people at home and they can't go out and they can't mingle, well, one good thing, of course, we haven't mentioned that, is that it's very good for the environment, because there's been less air traffic, less travel from cars, and the rest of it, and so the environment has been improving. And I'm sure all of you have probably noticed that you can see the sky much easier during the day. The pandemic of the environment is the next one on the table. Now, turning my last part of my talk, and I'm sorry to jump around so quickly, but this is the Financial Times as well, and you can see from here that the United States now consists of a third of the global daily deaths, that the rest of Europe is much smaller, about a third of the United States. And don't forget that Europe has got about the same population as the US. And if we look down here, we can see Africa, very, very tiny, coming along here. So we see still that Africa has escaped the pandemic. Now, is that because it came here later? The first death in Kenya was on March the 15th. I think in South Africa it was about the same time. And from what I can understand from the graphs, again, I'm not a medical doctor, is that the main problem seems to start between day 30 and day 45, if you look at the graphs. Now, Africa, we're just starting day 30 since our first death. I'm hoping, of course, that it's not going to get any higher. The authorities in Kenya, similarly to South Africa, are very, very serious about what they're doing. But as you can see from this graph, they've tested 15,000 people, but these are mainly people who traveled or been associated with travelers who had the disease. It's pretty small for a population of nearly 50 million. I think South Africa said 60 million, and if you remember, the figures of testing there were much bigger. So they're a bit behind here. It's also expensive. They don't have the tests. They want to reach out. They're talking about increasing that to 250,000 in the next month or so. So every day these figures come up, are published. The numbers of confirmed cases are only 303. What's interesting in this country too is that the president is on TV just about every day wearing a face mask and encouraging all sorts of things for the Kenyan population. And I think that is quite impressive, that he seems to be very much on top of it. But don't forget, Kenya is a semi-developing country in the sense that it's not a very rich country, and because of that, it's got a long way to go to catch up with the advanced countries. So these are some of the responses of Kenya. Is a curfew that starts at 7 o'clock in about an hour or so's time. Social distancing, it's not obligatory, except in some places. Face mask in public places. Closed borders. No movement now across the main counties. Stop just about all international flights. Quarantine suspected cases are mainly foreigners and contacts thereof. Many people don't observe all this. and especially in the poor areas. And that's why I come to the end of my little chat here, is that are we in day 30 going to jump or decline? I hope for everybody it's going to decline, but this is where we are right now. And I see just popped up is my art for basic income. So you can see that the line in Kenya is increasing quite steadily. Is it going to flatten out or is it going to continue? My fear is that the fact that in the slums there's not an awful lot of social distancing. People just can't do it. They live very, very, very close together. So I fear the worst and hope for the best. And then I come to my last slide, I think. The next slide.
You wanted to
The
go,
next
you
slide
wanted
is
to go to
about.
the video, I think, Mike, and that would be a good idea if you put the
Yeah,
video.
here we are. Let me just get to this, Alex. And this is an article that myself and my friends wrote about rolling out a basic income for the very poor in this country. And we think this is actually applicable right across the world. A basic income, a targeted basic income for the slums. But unfortunately, it's expensive. But these people, if they're asked to stay at home, how they're going to get any income? They can't live by that. So the next pandemic could actually be hunger. But the thing is that please don't just give people food, give them money so they can buy food, which then helps the local economy. Income actually has a multiplier effect, a basic income does, and so this is incredibly powerful. We're trying to push this here in the slums in Kenya. I saw that was something going on in South Africa on unemployment, but it's still very much the beginning, and it's pretty urgent. And the last slide. I see 84% of you have said that you think basic income is necessary. And I think I'm coming to my last slide. Am I ahead of time, Alex? If it'd be a record for me if I am.
No, we actually ran out of time, but you did a great job as always, Michael. Let's watch this video that Michael proposed. It's only 1 minute or less on how the situation was very recently. This is 3 weeks ago or so. The Prime Minister of the United Kingdom talking about shaking hands or not, and then, as you know, he got infected himself. Thank God he's fine now. But roll it if you can, please. Go ahead.
It was about a month ago, I think.
I was at a hospital the other night where I think there were actually a few coronavirus patients, and I shook hands with everybody. You'll be pleased to know, and I continue to shake hands. And I think it's very important that we, people obviously can make up their own minds. I think that Matt has said that people must make up their own minds, but I think the scientific evidence is, well, I'll hand over to the experts. But our judgment is wash. Washing your hands is the crucial thing.
So as we know, he continued to shake hands, and then he got very sick with the COVID. But as I said, thank God he recovered. He's back at his work. He's much needed. Any government leader is needed. But let me give the final comments to Michael Hopkins, and then I will close. Michael, please.
Thank you very much, Alex. And you told me not to make any political statements, so I won't. The only thing that I have in common with Boris Johnson is that we both speak very quickly. And with that...
Thank you. That's a very good way to close.
Thank you very much, Alex. And thank you, everybody else, for doing a great job.
Absolutely,
and the best
absolutely.
of luck.
It's a great pleasure to have had Professor Michael Hopkins, quite an academician, and formerly one of us, a senior government official, a UN official here in Geneva. But with this, let me just wrap up with something, because the Q&A, there were very many very interesting questions and comments, and most of them have been addressed by the panelists. And if not, please take some time now. We have 2 or 3 minutes only before we wrap up, but write some of the answers. I wanted to focus on 2. One from Dr. Samuel Jacobs Avi, quite interesting. He posted 2 or 3, but Dr. Jacobs Avi, in the case of South Africa, actually tried to portray the balance that we need to have between the public health perspective and the economical perspective, as we have said. So let me read what he wrote. He said, "Thank you very much for the great presentations. It's been very resourceful. I'm following closely the presentations from South Africa And I wonder why there is such a, I congratulate that there is such a low death rate in South Africa. With that, I don't understand why South Africans are on the street demanding government to open the nation. Is it that people don't understand the importance of the lockdown? Thanks, Dr. Samuel Jacobs-Ave. This is quite interesting, and I'll tell you why. If a country is actually sparing the worst of a pandemic, so there is low death rate and low contagion, people then tend to think, oh, we don't need the lockdown anymore. We are out of the woods, so we can go back to normal. But it's exactly the opposite. At least that is what our colleagues at WHO say. And that's what Dr. Samuel Jacobs-Ave indeed implied, that because the lockdown is working, the number of contagions or deaths are low, so you need to maintain the contagion. You see this dichotomy? People with the same numbers, with the same scenario ahead, saying, oh, we should go out tomorrow. Or people saying, no, we should actually stay in home because the numbers are low. So that's, in the case of South Africa, quite interesting to see. Similarly in Portugal, similarly in several Latin American countries, the case of Brazil is quite unique. The president himself saying, no lockdown, we go about our normal lives, because people tend to privilege the economic impact. The economic impact should be lower, especially in developing nations where people actually live week by week or day by day. And I'm not exaggerating. People actually need to go out today in the morning, for instance, to make a living, to be able to eat tomorrow. So it's a complicated dichotomy. It's a new paradigm in which governments have a very difficult decision to make, always with imperfect information, because depending on the testing, the number of tests actually performed in a country, you actually have an accurate, or lack thereof, an accurate picture of how this pandemic is evolving. If the number of tests administered to the population is low, then you are basically driving blind, because the actual reported number of cases of people infected is not correct. In the number of deaths, it perhaps is a little more accurate, but testing is important. So to wrap up, and thank you for the panelists' answers to all these questions and answers that the participants have posted. We need to have this balance in a multidimensional crisis with no precedent, from public health to a social crisis to an economic crisis. And I hope it doesn't become a security crisis. This is the webinar that our colleague Julio Andrade from Spain was participating, was a United Nations webinar on the challenges of the coronavirus pandemic to safety and security, and counterterrorism and cybersecurity and so on. So again, these final comments are simply to thank everyone for taking the time to join us, the panelists first, but also the participants. We have had more than 100, now a little less, of course, after 2 hours. But my respect to all of you for engaging with us and for sharing your knowledge or for listening. This is what we need to do more frequently. We need people to actually hear what is happening and to actually hear the experts. Because you see, one of the main issues that we didn't address today, because there is not enough time, is what is happening with fake news and how people have actually exacerbated the sense of anxiety and depression that many people live within this lockdown. With that, dear colleagues, I'm thanking again all the participants and the people that watch by YouTube, Facebook Live, and here in this platform, Zoom platform, excuse me. On behalf of UNITAR, I would like to express our appreciation to all of you, and I declare this webinar concluded. I wish you a good day. Goodbye.